Welcome, medicos. Let's begin with this quote. Knowledge is the key to success. In this world, knowledge is everything. Keep learning every day. One day you will achieve what you want to. Let's begin with today's topic. So today we will be discussing about the clinical aspects regarding elbow joint. So we will be discussing about nursemaid's elbow, tennis elbow, golfer's elbow, and students or minor's elbow. So why this is important is this may come as a MCQ. Most of the time it will appear as an MCQ or for your VIVA. So let's begin with the topic. Nursemaid's elbow or pulled elbow. This occurs in preschool children 1 to 3 years old. Whenever their forearm is suddenly pulled in pronation, the head of the radius comes out of the annular ligament. That is why we should be very careful whenever we are handling kids. The head of the radius, it comes out of the annular ligament, and then the elbow is kept slightly flexed and pronated. And after that, whenever the child, or if we also try to supinate the forearm, it causes severe pain to the child. Tennis elbow or lateral epicondylitis. This is very important because this may appear as an MCQ. That tennis elbow is also known as, then the option will be lateral epicondylitis or medial epicondylitis. So we should remember this tennis elbow is lateral epicondylitis. This is a clinical condition. It is a clinical condition characterized by pain and tenderness over the lateral epicondyle of the humerus with pain during abrupt pronation. It occurs due to either sprain of lateral collateral ligament of elbow joint, or there may be a tear of the fibers of ECRB, that is extensor carpi radialis brevis muscle, or inflammation of bursa underneath this ECRB, or there may be strain or tear of common extensor origin. So we know that common extensor origin is lateral epicondyle. So remember, lateral epicondylitis is tennis elbow. So this is the hand, this is the medial epicondyle, this is the lateral epicondyle. So lateral epicondylitis is tennis elbow and medial epicondylitis is golfer's elbow. Let's talk about golfer's elbow. This is medial epicondylitis. This is the medial epicondyle. This is a clinical condition characterized by pain and tenderness over the medial epicondyle of the humerus. It occurs due to strain or tear of common flexor origin with subsequent inflammation of the medial epicondyle. And we know common flexor origin is medial epicondyle. So why it is known as golfer's elbow is because it occurs due to the repetitive use of superficial flexors of the forearm. Since in golf there is a repetitive use of superficial flexors of forearm, hence there can be strain and tear of common flexor origin. It's not necessary that it is always associated with golf only. Many other activities will or may lead to golfer's elbow. So to talk about student's elbow, it is also known as minor's elbow. This is characterized by round fluctuating painful swelling over the olecranon. Olecranon process is the part of ulna bone. This is humerus, this is ulna, and this one is radius. So you can see this is the olecranon process of ulna. This is the subcutaneous olecranon bursa. You can see the size is increased, so it is enlarged and inflamed, hence there is pain. Since there is a inflammation of subcutaneous olecranon bursa, student's elbow is also known as olecranon bursitis. So to sum up, tennis elbow is lateral epicondylitis, golfer's elbow is medial epicondylitis, and student elbow is olecranon bursitis. Hope it was helpful. We'll get back to you soon. Before doing anything, we should decide first, then commit ourselves towards it, and hence we'll succeed. Thank you.